Yeah.
Yes.
Awesome. Thank you.
All right. So I'll read the first question.
Okay.
The first question is, did you experience the feeling of being unexpectedly thrown into uncharted waters by the pandemic?
Absolutely. I don't know who didn't.
I definitely did, especially like I was a new grad last March. I finished school last summer, or last spring.
Yeah. So like, yeah, that being just being a new grad, just being thrown right into it. How was that experience for you?
I did not like it. I don't think anybody did. So I came out at school and I started my job in the summer. I started my job about the time where everybody else started to go travel. So I came out at the worst time. I remember the first night off orientation, which was like in November, I had 7 patients and I was told in my interview I would never have more than 5.
Oh.
So it was no fun for me.
Yeah, I think my orientation was in, I think February, like the sit down orientation, and then the on the floor orientation was in March. So it was still very early.
Yeah.
But I had, because usually, you have 1 preceptor, 2 okay. Every time I came, I had a different preceptor because either we were short staffed, someone was being floated. My primary preceptor, she was immunocompromised. So she, I think I was with her for like 2-3 days. And then after that, I didn't work with her anymore. And I was just bounced around, which was nice in a sense because I got to see everyone's different teaching styles and just the way they provided care on the floor and administered medications and stuff like that. But you still want like a sense of
continuity of care.
Yes. And so just getting all these different inputs, and every time I had to adjust to be with someone new, that was a little I guess frustrating. Not really frustrating. It was just different than what I thought it was going to be, than what I was told it was going to be. But I mean, we're meant to be flexible and to adapt. So hey, I think that's what we all pretty much did.
Well, I come in to be deployed almost every day, so I didn't know where I was going to be. So one day I would be here, one day I'd be there. I could be at Northeast, I could be at Harrisburg, I could be at Kannapolis. You didn't. So you really didn't, and every day was different, and every place was different. So you're right. You had to adapt real quickly. And I did not like that either.
I don't like it either.
It was also scary because like coming out of orientation, that's when the talks were, because I work in a rehabilitation hospital, so we're separate from the acute hospital. And they were like, if numbers really go up and they're really short staffed, we're going to start sending our nurses over to med surg, which I was like, I'm excited, but I'm also like still new. I was like, I'm still getting used to my unit as a nurse. And now and I'm sure this goes for everyone. Like when you get floated to a unit you're not familiar with, you have to get acclimated to that environment, that culture, that unit, the doctors, who you go to. I was like, wow.
But during the pandemic, you were having to get acclimated to everything that was going on with the pandemic, and everything changing every day. So you're exactly right.
Yeah.
But I had been a floor nurse for 26 years, went to the ER, and I was afraid about having to do blood again. And, bedside nursing is totally different than the ER.
It absolutely is. I have learned that.
And I was afraid I would do something that would compensate or cause problems to my patients or even to the other employees, because I wouldn't know what to do, because they don't have time to give you other than here is your orientation for this unit, goodbye, because each one of you've got 7 to 10 patients and let's go. So, and that's sad.
Yeah. Jeez.
So that affects the quality and the safety of both the patients and us.
Absolutely.
Yeah, it's definitely kind of dangerous. med surg to med surg floating is like one thing, but like when you're floating ER to med surg and back and forth, that's dangerous in my opinion. And I know it happened. A med surg nurse does not need to go to the ER. An ER nurse does not need to go to the floor.
You are correct.
And oh well, it happened.
It makes me curious, like, what is ER nursing like?
Our philosophy, and please don't take this bad, we treat them and treat them. The goal was to get them in. You get a picture of what's going on. You try to get them help quickly and possible, and get them out as quickly as possible. We have like levels 1 through 4. 1 being we're doing CPR, 5 being you need a prescription. Our levels 4 and 5, we try to get out and then be seen everything within 45 minutes to an hour and a half. Oh, wow. Level 3s, they want out anywhere from 3 to 4 hours, and that's the max. They want our doctors to be in to see the patients within 20 minutes, have orders. They want us to have, once the discharge is up, they want us to get them out of the ER within 15 minutes.
Wow. So you guys have quick turnaround.
Yeah. Well, we're not meeting those metrics as like we should, but they put things in, like if they put up for a discharge, and they laugh at me because I call it an angry house. There's a house that goes up, and if it's up there, it turns red and it looks like it's on fire, and I call it the angry house. So if it's on fire, you're past your time, so you try to get them out. We've done a lot of different changes during the COVID trying to help with that, but then again, if you don't have it 3 or 4 nurses, you can only do what you can do.
Absolutely.
But the goal is to get them in and out as quickly as possible, but safely getting the care they need. I don't know if that kind of sums it up, doesn't Cody?
I think that's accurate. That's absolutely accurate. In and out as quickly as possible.
Yeah, and I don't mean that but treat them as treat them, but that's, if you go in the floor, it's to try to get them. You get them out of the ER to get them to the floor so that y'all can better. We stabilize them, get them out. Stabilize them, flip them as quickly as we can. Whether it be fly them out, going by driving, or they leave. So,
makes sense. I mean, you need to get ready for the next one. Yeah.
All right. So next question. Question number 2 is, can you identify any of the psychological stresses associated with symptoms that you experienced brought on by the uncertainties of the pandemic, and what affected you the most?
The unknown. Yeah. No matter, you never knew what was going to walk in the door, how it was going to walk in the door, and what you were going to have to do when they walked in the door. Because they could come in coughing, they could come in holding their chest. You never know. Right. And that I had chest pain sometimes because when a carload would come in, because we were screeners, carload of people would fly up, then people would jump out. They were going to tell you got to dig them out because they've overdosed, or this person's coughing, or they've got a fever of 102 or 103, or they didn't know. And then they'd started flying to cussing at you because they couldn't come in with their family member. So you kind of had to prepare for everything. So again, the unknown is in nursing, but it was more unknown because they didn't know either. And we wasn't quite sure which way they were going to go.
Right.
I think mine was a little different. So like being on the floor, I got to a point where I would cry before I went to work, because as a new grad, I never thought I would have 7 patients. And to see like nurses that have been there for like 15 years struggle with 7 patients. And then here I am trying to figure out, like, this patient's telling me this is happening and I don't know what to do with that. And then on the floor, there's no doctors. So you're begging someone over like a text message or something, and they just think you're stupid. I felt stupid, and then I would cry about it. I think that was kind of like what it did. It wasn't necessarily directly to COVID, but it was from COVID because we had no staff and I had too many patients for what was safe. But at the time, I didn't realize that wasn't safe. But now looking back, I understand that was not okay.
Yeah, I think mine is quite similar to both of yours. Just the unknown, not having appropriate staffing. A little different in the terms, like when we receive our patients, they're more stable. But I mean, acuity in inpatient rehab is getting more and more acute than what it used to be even 5 years ago. So I've been told. I haven't been a nurse for that long.
It is.
just like kind of like you were saying, Cody, it was kind of like, okay, you have this patient, this is what's going on. Funny enough, like for you, 7 patients is a lot. For me, it was kind of expected, like, hey, we try to keep you guys at 6, but 7 is usually average. I've had 9 patients before, and it just gets very, very overwhelming. And it's like when you talk about safety, being in a hospital that's separate from the main hospital, where we are our own IV team, we are our own RRT, we are our own everything. And let's say we can have a max of 29 patients. There's only 3 nurses on the floor. One of those nurses, she's also charged, or he's also charged. And we have 2 NAs. If something happens, what are you supposed to do?
Yeah, that's it. Everyone's in that room.
So, and that's happened a couple of times, and thankfully things, worked out, but it just sounds ridiculous, doesn't it?
Yeah.
Well, I'm right there with you. We're a freestanding ER, and you have your nurses. Sometimes we don't have an RT. We never have a care partner. No, we have a doctor, but again, the most you're gonna have in a room is 4 or 5 people. And then you're hollering for the registration person to call for some help and take turns doing CPR because you're all tired. But yeah, that's where you have to have good communication and trust each other.
Absolutely. Yeah. And definitely COVID didn't help with that. So, I mean, I think that's mostly it. Just the unknown, just understaffing and just having to get acclimated to everything.
Well, kudos go to y'all. I don't know that when I was a new grad 30 years ago, but I'm very proud of y'all. Y'all did good because it's definitely different. We were told we'd have a pandemic, but I never thought we'd have one. So it's definitely an eye-opening.
Yeah, I'm good to not have another one.
Yeah, me too.
My thing is, if we have another pandemic, I want a new job. I want to work at the bank or something where I just get sent home and I work behind a computer.
Exactly.
I'm okay with that. I can do a Zoom meeting all day. I don't want to be on the floor.
I mean, no. I'm not asking for another, and I'm not saying it was an ideal time, but I mean, I don't know if I should say it was also a good time because they always say you have to learn to be flexible and adapt and just change with whatever's going on. And this was the perfect time for that. So,
well, it makes or breaks a nurse. It'll make or break you. Yeah. And you'll know. So that's what I'm saying. You've hung in there. So that's a good thing.
Yeah. Well, thank you. We appreciate
it. Well, you're quite welcome.
I think we all answered that one. So the last question is, did you utilize any of the self-care modalities to help you manage these stresses and provide a little insight as to why or why not?
I can go. I don't know if y'all remember or you go. Where do you work at, Anastasia?
I work in Pineville.
Okay, Cody, I don't remember if you remember Kathy Carson from Northeast. She does the healing touch.
Yes, always wears white.
Yes, yes. I actually am a healing touch too, level 1. And she had a ton of classes, Zoom classes that we could go to. And I actually participated in one. And one of them, she wanted us to make something. So, and I got this, I don't know if you can see it or not, but it's bookmarks that I made for all of my coworkers. And it says, be yourself, accept yourself, value yourself, forgive yourself, bless yourself, express yourself, treat yourself, love yourself, and empower yourself. And I give everybody one of those. When we were having a bad day, we'd all flip them out. I know that sounds crazy, but it's a good little thing to remind you that you cared about. And then I pulled out all my lovely little oils, which I have here in my hand, my lavender and all that stuff, and we would sprinkle them in our mask. We'd do a seance of the unit, whatever. You had to do what you had to do to survive. But yes, we did. And we wrote journals. We done dances. I got a dog. I done everything I possibly could to help, because you have to have some downtime to take care of yourself.
All right, yeah, that's fair.
Yeah.
I definitely went the wrong direction when the pandemic first started. I definitely went toward the bottle of Prosecco, the booze. I would go home from work and have a drink and go to bed before the day. Since then, I have worked a little harder. I don't do that anymore. Stuff is settling. I don't know if stuff's settling or if I'm like more comfortable as a nurse because it's been like almost a year. I'm good. You know, a patient says I have this and this. Okay, I can deal with that. I know how to do that and not be stupid.
You're not stupid.
I know, but I felt stupid. I know I'm not stupid.
I understand.
I definitely felt stupid.
Can I tell you, I've been a nurse for 30 years and I still feel days that I'm stupid. So,
oh yeah,
that,
I know it's never going to go away.
It's no. And I say when I don't feel stupid, it's time to get out.
Right, there we go. But yeah, I definitely, when the pandemic first started, I was not good with self-care. Since then I've discovered I like music. I take my break at work. I actually take it. I leave, I go off the unit. If I'm clocked out, you're not going to see me.
That's good.
I think that was my biggest fix. So I'll leave, I go downstairs, put music in, sit there for 30 minutes, I'm good to go. But yeah, just take your break.
I am very bad about taking my breaks. It's to the point where like, even my healthcare techs will come up to me like, hey, did you go pee yet? Hey, have you eaten? And they're like, you need to go eat. I will watch the patients. Just get off of the floor. And I'm like, but if they need something, you can't do what I need to do. But I think overall, like, just whatever I can't say everything I've been doing before the pandemic I was able to do, because traveling is like my biggest thing and it's like the biggest stress relief outlet for me. So of course that wasn't happening, but well, not as much. So like, I don't know, to fulfill that, I would watch like travel vlogs on YouTube or something and just live vicariously through other people's past travels. But I mean, I like music. It was a good time to catch up on TV shows and movies that I haven't really been watching. Yeah, and just like, I know, like sometimes I would just find myself just going to the park and just go by myself and just stay safe, you know, with a mask or whatever. And it was nice because other people weren't really out anyway. So it's just me and nature just trying to survive. So yeah, I think those were my biggest stress relievers. And I know our unit did have things like virtual meetings where people, like if you had any concerns or if you just worried or you just needed to get things off your chest, they had those sort of meetings. And virtually you could have meetings with pastoral care as well. I personally didn't utilize any of that, but I know those were available.
We had a damn it doll too.
A what?
A damn it doll. A damn it doll. Damn it.
Oh.
I know that's not, but it works. If you have it about blam, blam, blam.
There you go. I'm good with that. Maybe I need one of those.
Yeah, right.
I'll have to get one.
Yeah, you can make it. That they're easy to make. Yeah. But that was a comic relief and it helped too.
Just talking to someone who has, like, I talk to my friends, they're not in the health profession at all, and just talking to them, like just venting about my day. I don't need someone to respond. I just need a vent, and they're just like, wow, that sounds rough. Makes you feel a little better.
Yeah.
Well.
Well, I think this helps us too. I know that it's stress trying to get all of it together, but it does. It helps tremendously because I talked about y'all too today, this last week at work. So, and Candy said hello.
Oh, good. I was going to say, you have to tell Candy I said hello.
I will. But it's not, you know, and when we've made numerous friends and it's something that we won't ever forget. So,
yeah.
That's fair.
I think we're all in a better place now.
Well, I'm going to be in a better place at the end of next month. When I start my new job, I'm ready to go back.
You might have mentioned it. What are you doing?
I'm going back to the ER.
Oh, back to the ER.
Yeah, I should have never left.
No, you shouldn't. But I'm.
No, I know. I shouldn't.
That's okay. But you had to find had to find your nick.
Yeah, everybody was like, do a year of it. Okay, I did 11 months. Yeah. Close enough. We're out.
Yeah. Where are you now?
I work on ortho med surge at Mercy.
Okay.
Yeah, not for me.
Okay.
No. Lots of experience, but that's we're done.
But it'll help you in the ER a lot.
I'm sure.
And so if you ever decide to go to the ER and state, not that I'm telling you to, but all the stuff that you've done in rehab will help you tremendously.
Well, that sounds nice. I want to I want to move more acute, so I'm thinking by the end of this year, I would like to go into med surge just because you get a wide variety of everything. I think the only thing that kind of turns me off from ER is that you guys do have that quick turnaround of patients, and I like to actually like talk and get to know my patients. And coming from an environment where, on average, our patients are with us for 2 weeks, and I see the same faces over and over, it's like 15 minutes later, okay, hi, don't really know you. Come on, okay, bye. Hi.
Oh no, let me tell you, you'll learn them.
Bye.
Well, I'm gonna tell you, won't she, Cody? You'll learn them. They know
Yes,
you by
so
name. They know you by
I
name.
I cannot stand having the same patient for 12 hours.
No.
Yeah.
Because like in the ER, sure, you learn them. You go in the room, they open up, they just start talking.
Yeah.
They don't shut up. I
No.
promise you'll learn them.
You'll
But
learn
you
more
get a
than
good
you
patient,
ever want to know.
yeah,
Okay.
but if you
Right?
have a good patient, they're good. If you have a bad patient, in 4 hours, you send them out. You're not stuck with them.
Yeah.
You will know more than you will ever think you ever would want to know.
Yeah.
I'm telling you.
Gosh. Do you get a lot of, I get this with my mom a lot. Like I'll ask my mom a very simple question. When, I don't know, like, you know, when you ask a patient, like, where are you having pain right now?
Mhm.
Well, back in 1972, my husband and I, on a very rainy day, we were just watching a movie and it was very crowded in a theater. And I'm like, are you
Yeah.
kidding me?
Yeah.
That's definitely still there.
Yep.
Is that what it's like on the ER on a daily basis?
Still there.
Yep.
I'll
You
come
have
in.
those?
That's saying come in at like 3 a.m. Oh, I've been having this chest pain. Oh, when did it start? I don't know, a couple months ago.
Mhm.
Yeah.
Year ago.
Yeah.
Year
Oh,
ago.
this is chronic.
Yep.
Oh my God.
You'll be surprised.
That sounds
It's
fun.
okay.
Maybe I'll work my way there.
Well, thank y'all very much. Do
Thank
we?
you too. That's all of our questions. We are good. And I'll get this uploaded. If I don't get it tonight, I'll get it tomorrow for sure.
You're fine.
I'm still moving. I am like literally sitting around like boxes. I moved yesterday, so I like don't know where anything is.
That's okay.
Congratulations.
Well,
I don't know. Yeah, I'll definitely have it uploaded before tomorrow night.
that's
Take
okay.
your time. I mean,
Yeah, we're good. Thank you very